There are some situations uh, where drugs are particularly dangerous if people have been on them for a long period of time. Particularly the benzodiazepines like Valium and Klonopin and Xanax, and also alcohol can be a dangerous drug. We do a thorough assessment regarding where they're at with that when they come in, and if they don't have unusual risk factors, we can detox almost everything that we see here. If there's concern that this could be a more serious detox with one of those more dangerous drugs, or if there's a history of them having had problems detoxing with that in the past, then we would, of course, send them to a more specialized facility to get that piece done. But to date, I don't think we've had to do that with anyone. You know, I do. I get a lot of medication, a lot of questions from parents a lot of times about why do you want to put him on a medication? And I want to reinforce that having kids on medication is not our goal. I do want parents to be aware that at least 50% of people with addiction also have a standalone, co-occurring psychiatric comorbidity, whether that may be anxiety disorder or depression or an adjustment disorder or past trauma. And in some of those cases, they need to be on some medication to address that, particularly with things like if they have inability to sleep. It's hard for them to be focused and hear what it is we need them to hear in group if they haven't slept. Some kids with a standalone anxiety disorder are so anxious they can't remember things if they exist in that state. And so it's important for us to use medications that are not addictive in a judicious fashion, but to help them control the symptoms so that they can get all that we hope for them to get while they're here. You know, I have this conversation about the changes that occur with a number of our patients when they're leaving, and I'll often find myself telling them, I wish I had a recording or a picture of you the first week that you were here and the person that you are today. And we often just get to witness some dramatic changes and young men who came in very hopeless and angry and frustrated at life, oftentimes, most often, leave smiling and optimistic and expressing a lot of gratitude and a commitment to try to go home and make things better there than oftentimes they've been in some time. Physical changes, well, you know, the things that they get here are things we hope they'll continue at home, which has to do with just balance. And by balance, I mean that they're getting adequate sleep, that they're not eating junk, that they're eating really healthy, nutritious food, that they're getting physical exercise, that they're having quiet time, and we encourage prayer and meditation for them, or some venue by which they can connect with some power greater than themselves. We think that's critically important for people. And it shows on their face after a time. I think that it results in really some epigenetic changes in their brain that can make a big difference for them. But that's a critical part of what we try to do, is to teach balance and a healthy lifestyle. I often tell them that consists of everything that a sweet little grandmom would say, you should do that, that's good for you. What would I tell a parent who was struggling with what to do? I would tell you, don't wait. This illness last year in America killed over 65,000 people. And one of the things that I hear oftentimes is, well, it won't do any good, it's just not ready. The studies don't bear that out. The studies show that people who say, I need help, and those who come and get help kicking and screaming on the front end, they have an equal chance of success. So don't put that off. It's normal for us to, as parents, to say, well, I'll talk to him again, and I think maybe he'll get better. If they have addiction, it's not going to get better. It's going to continue to spiral down, and we need to intervene while we still got the kid here to intervene with, because not all of them make it. The top drugs that we see first is marijuana. There's a lot of reasons for that, but the recent national push toward medical marijuana and then toward legalization in many states, and I think soon probably in all states, has communicated to kids that this is okay, this is safe, it's even medicinal. Marijuana, for those who have addiction, is a highly dangerous drug. And we know well from the studies that kids who start using marijuana before age 16 have twice the chance of having addiction in adulthood, as does the general population. So marijuana is number one. A lot of the kids have been using alcohol very heavily. We see a number of folks who are also getting benzodiazepines through one route or another, and opiates, of course, have been readily available for a long time. But we're seeing kids who a year or so ago were just using pot, and a year or two later are on all those things plus heroin. So it can really take off, and the sooner we can intervene with that, the better. Marijuana affect the adolescent brain? That's a great question, and the answer is absolutely. It impacts the brain, and in profound ways that are really alarming. If we look at kids who began using marijuana before age 16, and by the way, in the most recent study of that, across America today, 6.5% of our seniors report daily use of marijuana, 6.5%, which is just an alarming number. We know that the cannabinoid receptors in the brain that marijuana attaches to exert its effect are scattered throughout the brain, and they're critically important. They have to do with coordination, with memory development, with a lot of things that are necessary if our brain is to grow and mature. We see in kids who have been using marijuana regularly since before 17, at age 32, scans of those brains indicate as much as a 85 to 95% reduction in the fibrous connections between critically important areas of the brain, and up to an 8% loss in IQ when you control for all other variables. And so marijuana has a profound impact on the brain. We thought forever that the genetics that we got half our chromosomes from mom and half from dad, and that was it. We've learned in the last 20 years that it's not it, that it's just the beginning, and that through any number of variables, there are what's called epigenetic changes that occur in the brain, whereby some genes can become shut off so that they don't produce as they're supposed to, and others can be opened up to produce in ways that we really don't want them to produce. That can occur in response to use itself, to particularly childhood trauma. And trauma can be defined as anything that's overwhelming to the system at the time of the occurrence. But we know that of the kids that we see, probably half have had some significant trauma in their life. And that can result in epigenetic changes or chemical tags that's attached on top of the genetic structure that can make them much more prone to a number of mental health issues, including addiction, anxiety, major depression, and a number of other problems. The illness of addiction, for what it is, it's a primary brain disease. We understand that. We understand that people who have this illness aren't bad people. Yeah, they've made some bad decisions, but typically underneath those, there's a real solid, healthy individual that's trying to get out. And as an addictionologist, I always get a little sensitive when people say, well, we send them to you for medication. Well, we do a whole lot more than medication. I want to see that they're healthy and they're growing mentally, spiritually, and physically, and that they're being equipped with the tools while they're here to have the life that we all want them to have and that their parents want them to have.